Yeah, so it's topic of voice and AI. It's a super exciting topic for me personally. So a couple of weeks ago, I was in Barcelona. I was giving a talk on the trends, so 2018, 2019, and for what would be happening in 2019, what would be the major trend? I had just one, and that was voice and AI. I bet on that, so it's very my pleasure to be here a couple of weeks after at SaaS with experts in the field, and to prove to you that I'm right, that 2019 will be a great year for voice and AI, and things are already happening. So I'm very excited to be joined by my different panelists today. So we're going to start with Patrick. So Patrick is the CEO of Sopris Health. So if you want to tell us a few words about Sopris Health and what exactly you're doing in the space.
Yeah, great, thanks. All right, hi everybody. It's great to be here. Thank you so much for hosting this. My name is Patrick Leonard, and I'm CEO and co-founder of Sopris Health. And so my background is building technology companies and products. I've been doing that for 25 years, most of that time in healthcare, and consumer, provider, payer, kind of across the spectrum. And Sopris Health is a digital assistant that automates documentation for clinicians. So we make it so they don't have to type and dictate and all that sort of stuff. So voice and AI is really at the heart of what we do, but we're also really about behavioral design and clinical workflow.
And so can you tell us what you found works and doesn't work when it comes to like documentation of a medical?
Yeah, so a couple things. One is when it comes to voice in healthcare, one way we kind of think about it is first do no harm. Right? It's sort of like everything else in healthcare. Voice, we're very excited about it. We think it's a very powerful tool, but there are also places where voice can add overhead, and I think you have to be really careful to have voice along with things like behavioral design and really deep understanding of clinical workflows, because these are busy people, and you can't have things that are difficult to use or that add time. So we try to use, in just as an example for documentation, we use our digital assistant as a combination of voice and screen because the interplay between those two, you can really optimize for speed. And in the case of medical documentation, speed and accuracy are really the key things. So voice is important, AI is important, but we think it's really, what's even more important is to be very thoughtful about how they're applied.
Thank you. Now I would like to introduce Michael Doctor. So he's the Director of Innovation at the Boston Children. So can you tell us a bit more about the work that you've been doing there with voice and AI? You've been pioneer in the field?
I'd like to think so. Thank you. So Michael Doctor, I'm a gastroenterologist at Boston Children's and clinical director of our innovation program. So I'm the physician that is constantly carrying the torch on we need to make our lives more productive, more efficient. We need to use tools to engage our patients better. We need tools to make nurses' lives easier. It's so important. It's a huge factor, and I'm glad you're carrying the torch on that. And so we, an example, we built the first healthcare skill for Alexa, really in the early days of that. And it was a simple tool to basically guide patients or families on the appropriate dosing of Tylenol and Motrin for a child with a fever. So super simple tool, but something that really added a lot of value and really just opened our eyes to the opportunity of voice in that capacity. As a separate note, we spent a lot of time on the workflow and the clinician side of voice. And so using tools like Dragon and Sopris perhaps one day, we are really trying to take the patient and actually allow providers to look them in the eye again. And so my mission is, turn our backs, towards the computer and not the patient as we currently are, clicking away on your keyboards and using voice in a compelling way. And so we've implemented Dragon. There are probably close to 1,000 providers on that platform, or Nuance's platform. And it's literally saved tens, if not hundreds of thousands of dollars in dictation costs, but also reduce the amount of time we're spending actually documenting. And so I think there are a couple of really interesting factors in voice. There's the consumer-facing stuff, and then there's the provider stuff, and I hope we get into some of that.
So maybe a short intro for those of you who are not too familiar with voice and AI. So it can really be applied in different fields within healthcare. So it can be to support the patient, so it can be used for adherence, make sure that the patient are more encouraged to take their medicine, follow up between visits, tool to improve the relationship between the healthcare professional and the patient, and we just mentioned, so there will be just more human relationship instead of turning the back to the patient, as we just said. Then, like Patrick was mentioning before, like to improve the clinical workflow. And I guess the next step of voice and AI would be just listening to the voice, being able to detect like like chronic disease or cancer, etc. So those are different scope of voice and AI that we can discuss today. Shawna, so we talked about...
and I'd actually like to add to that, because we talk about voice, but the more interesting thing to me is the sound. So voice is somebody speaking and being very intentional. We have a whole host of folks where they can't speak, and sound really gives us context. So it might be that one of the nurses that I've been working with, she is brilliant, and she is using she's using voice or sound technology and the sensors to help support lactation, help breastfeeding. And so she's got a sensor that goes on the bra strap that is picking up the sounds of the baby suckling, and using machine learning to know what that child's sounds like when they have an appropriate latch. And then there's this exception rule, and the moment that exception where that baby's not latching, it notifies lactation consultants, who then can call, hey, how you doing? Is there anything that I can step into? So that's just one really sophisticated use of voice, but it's really sound, because sound picks up context. So when you think about like a black box recorder and a plane goes down, or people under stress. So one of the things that I think I love about what they're doing at Boston Children's is safety. So the checklist, but they're recording the team and they're looking at the team dynamics. Did I feel empowered to say, I'm worried about the sterile field? And so they can tell not only what was done and use a checklist, but how long did it take? Was there hesitation? So I just wanted to, it isn't just the voice articulation, there's a lot.
No, this is very true. Yeah, thank you. So Derek Mazur he works at Sante Ventures. So are you currently investing in voice AI? Are you looking at voice and AI? Where do you see the more opportunities in the field?
Yeah, so it's a part of my job to have a pulse on anything that's new and up and coming in healthcare, and it also helps that I like doing that. So voice and AI is definitely something we've been looking at a lot, and that's actually so how I got connected with Patrick was one of my partners, Joe Cunningham, was looking at a company out in Denver doing basically like automated note-taking in doctors' offices, and that's a huge pain point. There's a lot of physician burnout that's associated with, and nurse burnout, providers, right? It's like, we're all sort of familiar with Salesforce more or less, and that is Salesforce to the extreme. There's just so much time that's taken up by doctors and nurses and all providers having to enter in patient information. So that's something that we're listening to a lot. And I think what Patrick's doing is addressing that pain point so directly. And so, I think that's a need that's going to help a lot of people. And think about it, the less time your doctor is, or your nurse is spending time putting notes in, the more time they have to speak with you. So it helps everyone.
Exactly, yeah. And so like question for all of you now, I want all of you to participate, just jump in. How do you see AI impacting the experience for the user, being patient or healthcare professional or nurse?
So one of the pain points or the discomforts is so many of our family members feel like they're not being paid attention to. So when I am sitting here doing this, I'm not with you. I'm not really intuiting and feeling what's going on. And so there's an emotional connection that I think that it really helps us to go back to truly when we think about hands-free. We talk a lot about hands-free, but I would love for people to be thinking about it as germ-free, because every time we touch something, we introduce the opportunity for infection. So it creates, I think, a much better connection. I think it gives us better safety. And then going back to that sound piece, it is really interesting for somebody who maybe doesn't have the same level of cognitive ability, or maybe they're post-surgery. We actually were just working with a company that came into Radboud who had an AI solution, and they asked the nurses, could they go ahead and test it for them? And there were a couple of the nurses there that just kind of rolled their eyes, and they're like, what is it? And she said, well, we're in the trauma section. So most people don't want to be here. They didn't plan to be here, and they don't come with a lot of these devices that you're talking about. They couldn't tell you if they hurt. So going back to the sound piece, what they started adapting was what was somebody's level of moaning, groaning, how long did it take for them to ask for help? So it goes back to being able to have another way to communicate without, maybe you're intubated, so you can't speak. So it was really interesting, this trauma nurse saying, yeah, a lot of this is just not going to work for our patient population.
Yeah, I would just say that, if you ask physicians and nurses and other clinicians, did they go to school to click away on a keyboard? And I would hope the answer is no. And so I think, even in my relatively short career, I've seen, the increasing burdens of the electronic health record. And that's not the only problem. It's the administrative tasks that we all have to do. But ultimately, we all went to medical school or nursing school or what have you to look at patients in the eye and to, in my case, feel their bellies, or, really establish a relationship. And the placebo effect of that is tremendous. The relationship you have with your provider is paramount to almost anything that you'll prescribe or certainly any document that you generate or bill that you submit. So how do we use technology in a multimodal fashion? It's not just voice, although voice is the new, user interface. It was clicking and touching, and I think voice, and then hopefully more visual tools that can supplement. That's really where we want to go. I think we want to no longer be slaves to our computers and really get back into that really engaging and important relationship that we have with patients. That's what it's all about. So finally, I think technology, the pendulum is swinging, and all of this burnout talk is reaching quite a hot point. And I think now it's the time to see this investment in technology to make not the threats of doctors and nurses going away because AI is going to take over are largely overblown. Not going to happen. What they can do is make an augmented experience that make us smarter, make us more intelligent, and allow us to focus on the relationship, because that's ultimately what matters.
Yep. And speaking on that relationship piece, one of the other things that I've seen is we talk a lot about prescription, but when people have a sense of power or control over what happens to them, that moves over into a very subtle place of enablement. Mm-hmm. And so we're giving them tools, not just prescribing, but we are then giving them tools for them to enable how do they access their needs.
So, Aline, I love your question about sort of what's the broader context of this. So if I could sort of, soapbox for a second here.
Yeah.
I believe that the goal should be that everyone on the planet has the ability to live an extremely long, healthy life, right? So if you think about the people in countries like the United States, most of Europe, a lot of other places who have good health care, but even the people who have the access to the best health care in those systems still probably are not living their longest, fullest, healthiest life that they could. And most of the planet, 80% of the planet, is not anywhere near that. And we can't, so to your point about doctors and nurses, of course are not going away. We need 10 times more of you. We need 1,000 times more of you. And so that to me is really the broader goal of AI in particular, and voice is a component, but AI in particular is how do we 1,000x the clinical capacity of our global healthcare system? And I think that is the target that we're shooting for, and there are many pieces of that, and that will be years. But that's, I think, where we're headed, is how do we give you all superpowers, and then 1,000x the capacity of that.
And maybe it's just one point that, Michael, you mentioned before, and we had that discussion when we talked some weeks ago. Voice is not always necessary, right, in those type of solutions?
Again, I think it's like Shawna was saying, the voice is an incredible tool that can be used for things that are relatively straightforward, like speaking to a computer. It can be used for things that are very not intuitive to most people, like your example of breastfeeding. That's amazing. I hadn't heard about that. So I think we need to just really think very broadly. I mean, we're focused today on how do we free up time for clinicians who take care of us, right? And that's a pretty straightforward use case. It was a challenging design problem, but it doesn't take a lot of imagination to sort of understand the problem. But then there are so many really interesting use cases that I think, most of us are just not even thinking about, and that 5 years from now we'll sort of look back and say, that's incredible.
Yeah.
So yeah, I think that's really, what's exciting about this is, we're not gonna none of us are gonna have all the answers. We're gonna do this in partnerships and working together, because each of us has a tiny piece of this puzzle, and we have to all put our heads together to really get these bigger things figured out.
Just to give credit to the developer of that, it's Christina Chamberlain. Her company is Gulp, G-U-L-P.
Good name.
Thank you. And so, yeah, something I wanted to discuss with you. So we always say that healthcare is like a slower industry to adopt solution compared to fintech, for instance. Who do you think are going to be the first to adopt like voice and AI? Like Michael as a...
We already have to some degree at Children's Hospital in Boston. And there's good reason for why we're slow to adopt in many ways. I think security and privacy, I think certainly fintech has its own issues, but I think the patient information is something that is held very near and dear, as it should be. I think the more that we empower patients to be the stewards of their own data, the more things are going to open up. But I think there are phenomenal use cases within healthcare, and I think we're slowly moving into that direction. And I'm proud of the work we're doing at Boston Children's to really just begin to show these early kind of trial balloons on what are the opportunities to leverage voice. I mean, just using the operating theater as an example, I mean, that is a space where sterility and your ability to use your hands is severely limited. And so while we don't have the HIPAA compliance and all the kind of patient context that's necessary to really build a tremendously useful tool, we've also been clever at navigating around that. But just even asking what particular blood tube do we use for a CBC, or to test certain blood chemistries in children. They all have to go in different tubes, and it's usually the nurses quickly looking for that problem, and that's a quick thing that you could just ask.
Well, I'll
Alexa
tell you, a good paradigm to think about that is every time you need to pick up the phone to ask, is a bed ready? Is the blood product ready? Anytime you have to pick up a phone, you're going to be using that voice technology. And I just want to share my prediction who's going to be taking AI? Teenagers. They are reckless and fearless. And so they experiment like wild. And if you haven't seen what kids are doing, go spend time with school nurses. And it is remarkable how kids are using the voice technology. I mean, they are the masters of Siri. When you go into middle schools and you go into the robotics departments and it's really, and if I had to even be further, it would be teenage girls. And the reason why it's usually teenage girls is because they're the ones that are menstruating. They're the ones that are trying to figure out sexual health. And they use these technologies. I am blown away. I can learn more from them than anybody else.
Okay.
Yeah, so just wanted to add to that. I don't think it's so much a question of who's going to be the first adopter, but I think it's whatever solution is going to be most natural to adopt. So in the example of Sopris, I remember I was telling my doctor this last week, I just mentioned it kind of in passing that I was looking at a company that had this, and he almost had like a knee-jerk reaction, like, what's the company's name? So it's an immediate pain point, and right, it's something that really integrates very naturally into what they're already doing. They're already used to putting notes into a computer, and to the extent that you can make that process 10 times faster and easier for them, that's going to be a natural adoption. So I just wanted to add that.
Yeah, and I think just to what it sounds like you guys have already said, the mundane nature of a lot of the work that we do, whether it's billing or it's, documenting, there's little variance in a lot of these things, and it's just a lot of repetitive stuff that frankly just makes billers and coders happy, but does nothing for the patient and certainly does nothing for us as providers. So that's a space where AI and voice are going to, I think, have the most value, because it's things that are discrete and obvious and repeatable. So machine learning can pick up on those things easily, and they don't necessarily detract from the provider experience or the patient experience.
You were asking about who's going to be adopting, and I was at a breakthrough day that Philips hosted, and their cohort this past year was on AI and radiology. And they asked the question of people in the audience, did they believe that this was really helpful? All of them said yes. And then they asked them, what's the biggest barrier? And the 3 expert panelists, physicians who had been running major departments, all said it was physician fear that they were going to be replaced. And all of them said, you know what, AI is not going to replace a radiologist, but the radiologist who's using an AI and voice will replace the one that doesn't. And I think that that's from the standpoint, from the standpoint of when we think about all of the technologies, it's the people who adopt it that are going to replace the ones that didn't.
Sure. Yeah, and just as a side note to that, it's not necessarily the young digital natives that are the ones that are adopting it. It's the older folks that are on the verge of retirement, and this is what saves them.
Yeah, I was saying, who are the people on Facebook? It's the grandparents. Yeah.
But I think, just there's a project we're working on at Boston Children's where we use, the incredible library of, small child MRIs of the brain that we have. So, there are not many places in the world that do more MRIs on infants and even preterm infants. And so we're using our capabilities in a partnership with GE to actually figure out what are the nuances of these, very either immature brains or maturing brains, and how do we kind of make a machine help guide a radiologist? So not replace a radiologist, but guide a radiologist, perhaps a radiologist who's in the middle of nowhere, who the nearest pediatric hospital or the nearest pediatric radiologist is 1,000 miles away. How do we arm their software with the ability to really screen for some of the things that, really a specialist who looks at these things for an entire career is able to decipher, and they would never know that otherwise.
And the other part about that is that when you keep using the word mundane, and that's exactly it. What I get excited about is that it makes their work more interesting. So if you don't have to do the mundane things, you actually have the brain capacity to work on the complexity.
It's a screening tool.
Yeah, and those are the things that are interesting and fun.
Yeah, Patrick, so you are starting a relationship with Children's of Colorado. Do you want to share a bit more about that?
Yeah, thanks. So we're very excited about pediatrics for a lot. Well, I'm a father of daughters, so that's, there's a personal connection there. And actually the impetus really for starting Sopris Health was my wife's idea that was related to personal experience that we had, and she's worked in healthcare for a long time. And so that's very personal for us, and we're really fortunate to have had a great relationship with Children's of Colorado to help us bring our technology into pediatrics. And we really see that as a very important area going forward because, one, because just the mission of the work, and two, because that just like the rest of healthcare, the physicians, the other providers, nurses in pediatrics, their time is so valuable, and we know as parents, when we have to wait a week for an appointment or 2 weeks for an appointment or a day for an appointment, right? Whatever it is, it's always too long. And it's because their time is so valuable. And so really that's our goal, is to free up as much of that time as we can. And then those providers can then, some of that time may go to seeing more patients. Some of that time may go to seeing their own families so that they can have work-life balance. However they choose to use that time, is going to add value to the system. It's ultimately going to, it's going to help patients and their families.
Make one comment. I don't think anyone actually wants to get healthcare. Of course, they need healthcare, but it's not like people are seeking this out. And so,
actually, they don't want sick care.
Yes, perhaps that's true.
They actually do want help.
They want health. They don't want health care.
They don't want the care.
We're just trying to figure out how do we lower the barrier to entry. And so, how can you use these chatbots and symptom tracking tools to actually be an initial screening tool to know that, oh yeah, I can stay home and I can just take Tylenol and I'll be fine. Or, there's so many patients that we see in a pediatric urgent care scenario that really should have stayed home. We could have easily guided them to say, hey, take some chicken soup and, take some Motrin and you'll be fine. And instead they're coming in and exposing other kids to whatever they have, and then they're picking up new stuff. So, there is an opportunity using AI, using voice. You'd imagine Alexa could easily be like the entryway to, a screening tool, and then ultimately even kick it over to a virtual visit where you're suddenly, on a video chat experience with perhaps a mid-level provider if it's something really, straightforward, and then to a specialist if it's something a bit more significant. But I think there's an opportunity to really reduce or improve the access to care by making some of these things that, again, I use the word mundane again, are simple things that really, you don't necessarily need to drive 20 minutes and wait in a sick waiting room and all that. There are ways to engage that
Is that
easier.
implemented in Boston Children already, those solutions?
Not yet.
Well, it's interesting that you would bring that up because as far as the range of care, Marie Johnson, she is somebody who's working in AI in Australia, and she's created digital humans. And part of what she's doing is she's focusing on post-MI aftercare, so all of the rehab. But it's a digital human that's based on using these AI and algorithms so that when you're having the conversation, you feel very much like you're connected to that human being. But so much of post-MI care is pretty much, we have algorithms for it. And like you said, there's a lot that's unnecessary. But part of what people are looking for is confidence. I'm feeling this chest pain, or I'm feeling a little bit of weakness here. Am I okay? So they're using a lot of this to make sure that they get the right information. So it's that interface, and it's very natural. How would I talk to somebody? Or to ask about, I took this medication earlier. Should I be taking it at the beginning? Should I take it when I go to bed? There's so many simple questions that they're looking for confidence to do the right thing. So it's interesting to see where these solutions are coming up, and more that they can be managed on their own.
And Aline, to come back to your question about adoption, I think what we're seeing in healthcare is a lot of willingness to try new things, and adoption of voice and AI, I would say in healthcare is probably on par with any other industry, maybe just behind consumer, right? But as far as other industries, but it's incumbent on all of us who are trying to push these things forward, whether we're a technologist, whether we're a clinician who's advocating for these internally to an organization. It's incumbent on us to clear the hurdles that are important and relevant, right? So accuracy is important. Trust, that they can trust the system, security and compliance. Those things, right? Those are all table stakes that have to be there. So, for example, if you go back to the use case of voice and AI for documentation as an example, those technologies have to either be near 100% accurate, or there has to be a person in the background double checking things, right? And so either way, the people using it have to trust that the end product is going to be highly accurate. And so that's an area that we spend an enormous amount of time making sure that we can prove, and that everyone can, and that's one use case. There are many, but for any of these use cases for adoptions, we can't just point at the healthcare industry and say, you guys don't like technology, you don't want to, right, you're Luddites or whatever. That's not really the case, right? We're seeing a tremendous amount of interest and understanding about where these technologies can solve real problems. And that may not have been true 10 years ago, but I do believe it's true today. But we do have to remember that it has to be ready. It can't, you don't move fast and break things in healthcare, right? That's not the way it works.
Exactly. Yeah.
Yeah, no, I think those are all really good points. And especially, the one about ending up in the ER or the urgent care when you don't need to. That's a big problem in healthcare right now. Everyone has heard all the same stats. It's just, frankly, say it plainly, it's so expensive in the US, and that's a big part of it. There's a lot of waste in the system because of that. And so things like telemedicine have been around for 20 years at this point, but adoption and utilization is just so low. And part of it is sort of trying to re-educate patients, and I'd be pretty confident in saying almost everybody here in this room has access to care 24/7 through telemedicine, but we don't even realize it. But not even beyond that, there's a psychological block at adoption, which is, if you think about any doctor's visit you've ever been to, it's a very tactile experience. The doctor's gonna look in your ear, they're gonna put a stethoscope on your chest, they're gonna, a telemedicine call has none of that, has none of those psychological properties to it. So that's not a ding on telemedicine. I think it's fantastic and a very logical option. But to the extent that you can make these experiences more human, that's why I like the comment about the Australian doctor who has a sort of a digital doctor version. I think that speaks to that point a lot. And so I think that's an important theme for all of us.
Just as someone that practices telemedicine regularly, it's not for everything. And so it's not a, it's not a one-size-fits-all. Certainly an urgent care visit where I'd have to look into an ear, that might not be an ideal case. However, there are now tools available that you can, have these peripherals that actually allow you to look into the ear for a virtual visit. For me, I take care of kids with Crohn's and colitis. Follow-up care is tremendous and far more accessible than driving into Boston in a snowstorm, missing work, missing school. There's tremendous opportunity in virtual care. And I think, there are certainly an increasing number of peripherals that allow you to have a more kind of physical experience in the sense that you can measure their vitals and whatnot. But it is still a tremendously engaging experience. You can still examine a patient. It's not as high fidelity as you might have in person, but there is a website manner to all of this, and we're certainly working on that at Children's now.
And I would say the adoption is not on the consumer side. The consumers are ready for it. I think the adoption is on the professional side.
Yeah,
I think
and it's
we're not
all about
adopting it.
it
Yeah.
boils down to payments too. It's reimbursement models. It's the governance around licensure and practicing across state lines and all that stuff. So there's a lot of regulatory stuff that's blocking. There's a real interest on the patient side and certainly on the provider side.
Mm-hmm. And I did want to pull up something that you were mentioning as far as that the product, and it needs to be accurate and it needs to be trustworthy. The other part that it needs to be is that it needs to be inclusive and it needs to be fair. And so what I see is happening with AI is that as it's developing, there are not very many people. It's a certain group of people. They all look the same. We don't have enough women who are involved in that. We don't have people with disabilities. And so what that AI gets, it's very efficient and it removes a lot of that. But what it also does is that it makes our biases that much more efficient. So I think it's a really important note when you're thinking about how we're developing these technologies to make sure that in addition to being accurate and trustworthy, that they're fair and they're inclusive.
Thank you, Shawna. So I would like to open the floor to some questions. But first, last question for all of you. What's the future of voice and AI? What's next for Sopris Health? What's in stock for Boston Children, if you can share something? What can we expect the nurses to see? Derek, as an investor, what are you excited about looking at the future of voice and AI?
Okay, I'll start. So I think from a technology perspective, I think the last 10 years in healthcare a lot of it has been about moving from paper to electronic health records, and that was a platform shift. And I think we're at the beginning of the next platform shift where the electronic health records systems of today start to move into the background and we start to replace them, where I think we're in the process of building what we call intelligent clinical operations. That's our term for what this next platform looks like. And we think voice and AI are key enablers of that technology, but it's wide-ranging across all of healthcare delivery. Our goal is that healthcare providers should be able to reimagine the processes that they deliver in healthcare without having to picture things like kiosks with PCs or computers on wheels, right? They should be able to really think about that from a very natural interactive where the technology is supporting, it's doing decision support, it's doing documentation, it's doing all the things that our clinicians want, but it's really staying out of the way and empowering them. And so that is a platform shift. That's not going to happen today or next week, but I believe that it's underway, and I think we're building a piece of that. We're seeing companies in a number of, decision support, patient intake. There are a number of different areas where there are companies doing really, really interesting things that I think over the next few years will start to get assembled into something that will look like a cohesive platform.
Yeah, so I think it's obviously still early days in the world of AI and voice, and exciting to be on the forefront of that at Boston Children's. I think the next phase for us is really expanding that and actually, hopefully, making it more engaging for the providers, for the patients. There are, dozens of use cases that we're excited to roll out as the adoption curves move up, as our, IT and infrastructure allows us to, kind of move on the bleeding edge a little bit further. Healthcare is always a laggard, but I think impressively, healthcare has actually jumped on this voice thing a lot faster than other technologies. And so, again, I'm excited about this opportunity that Patrick has mentioned about, making providers' lives easier. Certainly, we're excited about both the provider side and making patients more educated, engaged, opening access, all of that.
So my prediction around all of that is we're going to see a lot more unusual suspects participating in all of this. AI, like a lot of these are permission-free. A lot of the technologies that are in health, we have to go through a regulatory process. But if you're 3D printing as some type of an assistive device, if you're laser cutting, if you're creating a new app, if you're using some type of a voice, there is a whole group of, there's a tribe out there that are developing these new tools. So I think we're going to see a lot more of the innovation coming from the outside and helping to inform us, and I think it's going to be very much driven by our communities with conditions. So whether it's folks with Alzheimer's, with asthma, whatever, I think that this is the age of the patient innovator. And I mean, actually, I should say the impatient innovator, because they're tired of waiting.
Yeah.
And so Dana Lewis with We're Not Waiting and all of those. I think that is really, because we've got the permission-free, the cloud, all of those abilities for anybody, the barriers to participate are so low. And I also think that our curriculums in our professional schools, I think that they're going to recognize this and know that as we're preparing the next generation of caring professionals, they're coming into a very different environment. They're coming into a different way of practicing. Mm-hmm. And so they're going to have to change. And I think that it's going to be our digital natives who are going to dramatically demand that curriculum is different.
Yeah, so I think to kind of cap it off, the future of healthcare is seamless. And to take a page from the consumer world, there's literally a food delivery company called Seamless because they want to make things easy for you. And the threshold to access care right now is too high. And voice and AI is going to play a very big role in making care easier to access. It should be easy. I mean, I'm guilty of it. I'm sure we all have at some point. Not going to the doctor when you should have, or not going to that follow-up specialist when you should have. There are just gaps in care that need to be addressed, and people are working on it. And I think your point that there are going to be some unusual suspects. I mean, Google, Apple, and Amazon are in healthcare in a big way, and that's not going to change. And I'm sure they're going to have lessons learned because healthcare is very complicated, to say it simply. So I think you're absolutely right, but to say it in one word, I think the goal is for it to be seamless.
Thank you very much. So is there some questions from the audience?
We actually have some on Slido.
Yeah?
Yeah. This is a real quick, easy one. How many nurses are in the audience? Please stand up. Yay! Nice. Okay, so that was one. What AI tech is used beyond voice, beyond the voice to text tools like Nuance to understand the situation and the goals being pursued? So what AI tech is used to understand the situation and the goals being pursued?
I might just have an example. This isn't necessarily where this might have been going, but we have a tool that we built at Boston Children's actually that helps figure out at the time of or shortly after a patient enters the emergency room, what's the likelihood of them actually getting admitted. And what that allows us to do is predict many hours in advance of what it would otherwise happen, whether or not we need a bed free for that patient. So we call it predictor of patient placement. And so based on algorithms, based on the patient and their medical history, based on the labs and orders that the emergency room physician or other folks have placed, they can predict with pretty good certainty that patient, is going to end up needing an operating room in the next hour, or this patient is going to need an ICU bed. And that allows you to, start mapping out a lot about how your hospital runs. Yeah. And so patients aren't sitting in the emergency room for hours waiting for a bed. Yeah. We know in advance that they have a bed. Yeah. So, it's kind of, again, early versions of AI, but an exciting tool that will change care.
Exactly, yeah. Here's another. Anyone from the audience who has a question? Do you want to stand up? Yeah, over there.
Device field. My name's Mike Erickson. I've been in the med device field for almost 30 years on the business side. And often you go to meetings and you hear physicians talk from the stage about I do it this way just because I do. And there isn't any good data. There's no level 1 data. There's no investment in level 1 data because you don't have to as companies to do that. So how do you see AI playing a role in making data more robust in setting a gold standard for treatment?
Actually, there is a company called Empiric Health that is doing exactly that. They just launched last year, and they saved Intermountain Health System a lot of money by being able to. So here's an example: if you have surgical screws that go into your knee, there are 4 or 5 different types that you can choose. And so they examined this problem. They're like, one of them is 10 times the price, and by the way, none of them have any difference in performance. And so they found the most cost-effective solution. So there are people that are working on that. It's a very addressable problem, but as a provider, first of all, you care that you're doing what you know how to do right. If you're an orthopedic, you're like, maybe you care which screw you use, maybe you don't, but at the end of the day, if you're like, well, it doesn't really matter, and the more people are incented for value-based care versus, fee-for-service, and that's shifting dramatically these days, and there are people that are addressing that. But if it wasn't shifting that way, I don't think people would be trying to solve those problems, but thankfully it is.
Maybe one last short question. Anyone?
I've got one that they sent in. This
Okay.
is a good one. How can we best engage patients in making a better healthcare system when the business model of healthcare doesn't prioritize patient satisfaction or experience? You've heard of this thing called elections and voting. That is powerful. And I think what's been really telling is the last couple of election cycles, the number one concern that people bring up is healthcare. And it's generally not the healthcare, it's the cost, and it is the insurance. And so I've seen there are a couple of nurses in Colorado, as a matter of fact, in part of their primary care practice, they have voter registration there. And so it is really interesting to see our social determinants. A lot of people call them the social determinants of health. I really want to be provocative here. It's the social determinants of death. And if we don't get involved in figuring out what our infrastructure looks like, and making sure that where your zip code, your health is determined basically by your zip code, and a lot of that has to do, the census is coming up, we've got elections that are coming up. I think from the standpoint, it's a longer way, but so much of this is at the regulatory level, and our regulations and our standards represent what our cultural values are. And I think that's a really important piece.
I realize there's this perception that patients and families are not involved in, how we change care. I would say certainly at Boston Children's, we have a teen advisory committee, we have a family advisory committee that we meet on a very regular basis. I run a hackathon on an annual basis that gets patients and families involved in those hackathons. Those tend to be the teams that win, are the ones that have the patient and the family perspective on the team. So, I realize that perhaps is a perception out there, but I think it's these leading healthcare institutions that are engaging with patients and families and hopefully forging a path together.
Yeah. Well, I think we're gonna close the panel. Thank you so much, everybody, for your insights and for great content. Voice and I think it's very exciting space. I'm looking forward to see what's coming next and the deployment of it. So thank you. And please, so if you want to ask questions, you're going to stick around for a bit.